All right, let's turn our attention to COVID. The Chief Medical Officer, Regional Health Officer for the Central Public Health Region, member of the Mississippi Coronavirus Task Force, former president of SMA, Doctor, Chair of the Physicians, MD Chair of the Physicians Disaster Relief Program. When do you have time to see patients?
I'll work it in.
It's good to have you, sir. Appreciate it very
Thank you.
much.
Glad to be here.
You know, one of the things you and I were talking about, because I have my booster and you had your booster, and I haven't heard any negative effects on the boosters at all.
No, we've given well over 40,000
right?
either third dose or boosters at this point in the state, and really seeing no problems. You tend to have a little bit more of a immune response, which is what we want, but everybody's doing well thus far.
We have no idea how long that's going to last either, do we?
We don't. So we're moving forward with science and studying the antibody titers and how long they'll hold after a third dose. We know how long after a second.
How do you guys collect data on that, though? Because I want to know how long this is going to last. March of next year, June of next year, is it going to be necessary, if this thing is still around, to get like a flu shot on a yearly basis?
Well, the data that we're making decisions now are from the manufacturers. So Pfizer submitted their numbers first regarding boosting out of their clinical trials. Moderna just turned theirs in. Johnson & Johnson will be turning theirs in soon. Looks like all three are likely going to need boosting, but they're all coming out of the clinical trials that have been going on for over 18 months now.
Is Johnson & Johnson, for some reason, they don't have a booster, do they? Or did you say they are going to have a booster?
They're a single-dose primary,
right,
but they likely are going to require a second-dose booster rather than a third-dose booster. But that we're still waiting on those numbers.
One of the things, and it is amazing that we have people who are in opposition to this, and I can understand that. But if you are in opposition because you're just, to be honest with you, no matter what age you are, you're afraid of what it's going to do to you or your family, and that's I think that's the major reason.
That is the major reason.
So the only way that you put people at ease, Dr. Edney, on this one is you say you got to look at data on this and see what it is. Forget about the conspiracy theories and forget about all that. Just look at pure data. And that data is not lying one way or the other. Who died, who didn't die, why they died, who hasn't died, how many shots have been given. And at no other time in the history of mankind have we had a better ability to collect data. We're getting data in like a tsunami every 10th of a second because of social media, because of our internet, because of our technology that we have, supercomputers. We didn't have this back in 1918, I think was the start of Spanish flu.
Right.
If we had that data then, but, so that's one of the things. People need to be confident that data does matter.
It does. And, these vaccines have been more intensely studied than really any pharmacological agent in the history of modern medicine. And every reaction that's being reported is being scrutinized through the VAERS report, which is, a large conglomeration of reports from around the world. And we're we're into the billions of doses given around the world. We're over 400 million in the United States, and we are not seeing significant problems from these vaccines.
How many people have died taking the vaccines in the state of Mississippi, either of the three?
0.
There you go.
And nationwide has been less than 10. Most of those were related to the Johnson & Johnson clotting disorder.
And there's some arguments about that, too.
And that was identified. Yeah. That was identified by the CDC and corrected.
Well, I had 2 people in my family who's had for the second dose, and I think it was Pfizer on the second dose, and they had a real negative reaction to it. But some people have a negative reaction to the flu shot. Doesn't mean everybody's going to have that reaction.
But I look at it as a positive reaction because that's your immune system doing what it's supposed to do.
Yeah.
It's mounting an immune response.
Very good point, because they don't ask this. If you didn't have that second dose, it didn't provide the immunity, does that mean, guess what would have happened if you actually got COVID?
Correct. So when those who get their flu shot every year, some react vigorously to it, some don't. And it's all how your immune system responds to a vaccine.
Where do you think we are today with this thing now? Because we had the latest count this morning was 1,520 positive tests that just posted. And I think we had 58 additional deaths.
Yeah. We're doing better in terms of caseload, specifically doing much better in the hospitals. We lifted the public health order regarding the COVID system of care for hospitals that controlled transfers at the state level. So that showed, that our hospitals are doing better, the intensive care units are doing better. We still have a very high level of activity with Delta variant. The most important number to look at is the 7-day average. And if you look at last week's 7-day average, we're still hitting about 1,200 reported cases, 30 to 50 deaths, per day, and those deaths are going to hang up there for a while because it takes a couple of weeks for someone to get that sick that they actually succumb to COVID. So the people who are getting sick today, who are going to die, it's going to be 2 weeks from now.
Well, I'm not trying to put a good face on this, but we, with the beginning of school and football and outdoor activities like this, and nobody's wearing masks. You have to put that in perspective with where we are. It seems like it would have been even higher than that.
Well,
but I understand those are outdoor things, but school's not.
You remember we had a rough start to school.
Yeah.
And many, just about all of the school districts that were having difficulties pulled back into either virtual or mask mandates. Nationwide, we clearly see that school districts that have mask mandates for their students do far better than those who don't. Those who don't have 3.5 times the outbreaks that those who do have mask mandates. That's the science of it. So masks in schools work. We proved that last year. We had a good school year last year. We showed the nation how to do it last year, and this year we're getting through.
I go back, and we were talking about this yesterday with some folks. I go back and look at some of these old cemeteries where you see the graves the size of a shoebox. It's a little baby from some of the earlier pandemics, and you just think, man, I don't think they'd be arguing about vaccines.
No, and we had 2 more pediatric deaths reported out this week.
Is that right?
And those families wouldn't be arguing.
Were there underlying conditions?
Well, our philosophy is, it doesn't matter. And I don't know specifically these 2 cases, but, children shouldn't be dying of COVID.
Sure.
And we've had healthy children die. We had a healthy infant die this year. But, the majority of children do have underlying conditions, but we still need to protect them. They don't need to be dying.
This pandemic, this virus, COVID-19 and the Delta variant probably even more so, is one of the things where, our fathers were like that. They were stubborn. They didn't want to go to the doctor. And this one has the propensity, if you let it get a hold of you and you think you're going to fight it off as a normal cold or something, and you just decide not to go to the doctor and you're going to work through it. Sometimes it doesn't work out that way.
That's correct. And that's a very important...
I think that's what happened to a lot of people.
It happened to a patient yesterday in Vicksburg that just showed up a week too late. And so the message number 1 from the health department is plan A is be vaccinated. Plan B is monoclonal antibody therapy. So if you're getting sick, go to your doctor, get tested, get monoclonal therapy to save your life.
I think a lot of the confusion is, and people use this confusion and this mathematical formula, or whatever you want to call it, that one size does not fit all. And I think they use that to their advantage to confuse and conquer, because we have some people who have had the shot and then they have a breakthrough and then they think the shots are no good. But we have over 7 billion people on this planet, and we're not all the same. There's some differences on what we've gone through, the health of our